On behalf of All India Ophthalmic Society and the International Council of Ophthalmology, I welcome you to the symposium. Thank you very much for coming. During the course of this morning's symposium, you will get an overall picture of what ICO and AIOS are doing together to empower ophthalmologists everywhere with the help of examinations, knowledge, and any other support after that. And one of our most significant efforts in this direction is the ICO examinations. And we have with us the chair of ICO examinations, Claire Davey. And to give you an indication that the whole show is more or less led by clinicians, Claire is a London ophthalmologist who will speak to you on ICO examinations. Claire.
Hello and welcome. How many of you done ICO exams? Oh, 1, 2, 3. Oh yes, 1, 2, 3. Yeah. Okay, good. That means the rest of you want to do them, or at least want to advise people to do them. Right, examinations is the only worldwide medical specialty exam. All the other exams are countrywide. And we've done over 55,000 now examinations since we started out. We're basing it on the ICO curriculum, and the ICO curriculum gives a good consensus about what residents in ophthalmology should be taught. And there's a standardized content for training. So we base the examinations on the ICO curriculum, and we try every time there is a curriculum to put an examination to it. And you can see the website, the link at the bottom. We work with educationalists, and we have a team in the examinations. So we have the director, that's me, and we have the office admin, and there's about 5 whole-time equivalents working in the office to take all your admissions and your successes. There's an executive committee which is international, and so we're very happy to have Professor Grover here, who is one of our examinations committee. And there's an international question writers. The importance of this is because it may be reasonable that you know something about onchocerciasis, even though you will never see it, but it's not reasonable that you know about West Nile disease, which you probably won't hear about either. So we try to put it in an international context so that the diseases are relatable to everybody who sits it. The exams are criterion reference. This means that everybody could pass the exam if everybody's good, or everybody could fail it, depending on the difficulty of the exam. There's no one set pass mark. And we try to go away from that because exams inevitably are different in different standards. So we have a standard setting session whereby we assess where the standard should be. We run a foundation examination, which is a revision before you sit the exams. Then we have optics and refraction, basic sciences, and clinical ophthalmology. And these are the years that we expect you to sit it. The advanced exam, we wouldn't expect you to sit until you've done 4 years of ophthalmology, and the subspecialty exams, you must have spent at least a year in that subspecialty, and we do take certificates to show that you've done it. The fees are set in Swiss francs. We have 4 tiers. We're moving over from GNIPC to World Bank, which actually benefits India, which means that the prices for the exams are going down, which I think you'll be pleased to hear. We get reductions of fees for group bookings, and if a department or a centre is just starting, we give introductory discounts. If somebody says, I'd love to do the exams, but I really can't afford it, we do bursaries. So we can get things down in price. So the exam, what's the point of it? It gives international recognition. It means that if you're sitting the exam in India, you're as good, if you pass it, as those in Europe and as good as those in South America or in China. And you can compare your standards with ophthalmologists throughout the world. It has a higher standard than other comparable exams. So, for example, the European board exams, these exams have a higher standard, and therefore they're respected much more. They also give you points towards a fellowship, and also there is recognition for the optics and refraction and basic sciences towards the FRCS Glasgow. And if you have basic sciences, optics and refraction and clinical, you can then go on to do the face-to-face exams with the Royal College of Surgeons of Edinburgh. So there's a free practice questions, free to candidates. Once you've paid, you get a code which allows you to access it 24 hours a day. So it can be taken as a preparation, and it's only online, and you can do it twice. So if you apply to do the exams, for example, in November, you can sit it then, and then you can sit it again in March, and you can see how you've improved before the exams are sat in April. We also provide feedback on how you've done, and also you can see how you've been marking. So there's quite a big essay on each question to say how you went well or didn't go well. We use a confidence indicator for the foundation assessment, and you can say whether you're very certain you're right, not so certain, or whether you're not sure at all, and then you get different marks. But this is only an online revision test, so it's a formative exam, not a summative one. And then you'll get the results. The exams app is down at the moment, but we did have and hope to have again 100 questions on the app, but it isn't available at the moment, but it will be back up. The standard exams, the application process starts in September, and this year the exams are on the 24th of April. You download the form from the website, and you send in all these bits of information. And you're sent back confirmation, the syllabus, and the e-source, so that you have the books to read from. This year we've increased the number of questions to 120 for the basic sciences, now called visual sciences, and it's single best answer, 1 STEM, 4 options. It's a 3-hour paper. So this is an example. And we'll pick on people in the audience, not too badly. Can you read it from there? Okay, which do you think is the real answer? The third nerve. Who goes for 1? Who goes for 2? Who would like 3? Ah, good, we've got 2 people going for 3, and for 4. Anybody like 4? Okay. So, well done to you. You get the prize for this part of the talks. Optics and refraction, 60 questions, single best answer, 1.5 hours. And then this is the quiz. So the principle of total internal reflection contributes to which one of the following? Who goes for 1? For 2? For 3? And for 4? Yay! Let's see if you're right. Absolutely. Good. The clinical ophthalmology is 200 questions, single best answer, and we do have a lot of pictures, so it simulates a little bit better a clinical examination. So we have this patient and what's the first initial management of this patient? Okay, number 1, correction of the refractive error. Number 2, clear lens extraction, probably with vitrectomy as well. No need for treatment as the lens hasn't got a cataract. Or 4. Obviously less certain about this one. Anyway, it's 1. See what they can see first. Let's do the simple things first, as always. We translate into Chinese, French, Portuguese and Spanish as well as English. And that there is reciprocity with Glasgow and with Edinburgh, but if you want to claim the reciprocity, you have to have sat the exam in English, which is slightly more difficult. So your certificate will say that you passed, say, in Chinese, but it's not so relevant for India, I think. The advanced examination, still 85 questions, may be going up with extended matching, and majority of them are MCQs, again with the same format as before. So this is an example of an extended matching question. I think it takes too long to write, but we have a 62-year-old, either heroin addict, male or female, and we go for female. 3-day history of severe pain in the middle of the right side of the face. How many times a day? 5 to 8. Pain is prolonged, like an electric shock, and lasts for up to 20 seconds, is often triggered by a light touch of read. So that's the type of extended matching questions that we use, and this is the typical one of the single best answers. So the left eye looks like the right eye, which is the likely diagnosis. Anybody going for 1? Maybe it's too difficult to see the picture. Cotton wool spots, drusen or mudes. I think we'll go for 1. That was a picture of birdshot. If you pass the advanced exam, then you're able to use the post-nominals of FICO if you've had a local face-to-face exam. So, for example, if you have done your exam in India, you've had a clinical exam, then you do the advanced, then you can get FICO. And subspecialty exams, which we've been working so closely with the AIOS, has been online since 2017 in India and paper elsewhere in the following subspecialties. We hope to start cataract this October. And we welcome you all to come to Cape Town for the WOC. Now, because I've got to go and talk in another place straight away, would it be all right if we take any questions now about examinations? I think perhaps the thing I didn't expand on enough was the relationship with the Royal College of Surgeons of Edinburgh. They have stopped setting written exams now, and they will be using all the ICO exams in order to qualify the candidate to sit a face-to-face exam and then be given the fellow FRCS, Fellow of the Royal College of Surgeons of Edinburgh. And this is a big thing that we've moved forward with. Another thing we've been moving forward with is that we plan to have the advanced exam 2 times a year this year, and next year we'll have all the exams except for the subspecialty every 6 months, not once a year, because that's much more convenient for candidates. Any questions at all?
Significant percentage.
It's actually quite difficult to express that. Because it's so different in different countries. But also it's different if you've got a group application. Whether you apply as an individual, but it's about 10% less. But that's approximate, because it just depends how you apply. And it is It's less expensive this year than last year. Right, to the back. Less expensive this year than last year by about 10%.
To our knowledge, it's the only exam in the world where the fee is determined by the country's economic status. So a person taking the exam in Europe, for example, will pay a lot more than a person taking the exam in India or South America.
Which we think is only fair.
And though it's an identical exam, same exam administered all over the world at the same time, it's not any different from where you are. Okay. I think Claire now has to attend the other session. We only discovered yesterday there was another session talking about ICO and ICO exams. So we thought since Claire is here for this, she will now go across and speak to them and take questions there, and we will continue with our program.
Thank you very much
indeed. In order to emphasize the fact that ICO is an organization just like AIOS, which is run almost entirely by clinicians for clinicians to empower ophthalmologists to heal better. We have the president of ICO, a vitreoretinal surgeon from Leipzig in Germany, Professor Peter Wiedemann.
Good morning. I expected to be the first speaker and talk about exams or make an introduction to exams. As I was at the presidential guest lectures and they started late, I was late, and so you have heard everything about exams already. I certainly cannot do it better. So maybe, what should I say now?
Could you tell us about the role of ICO, what ICO does to help ophthalmologists?
What ICO does? I just had a talk on what can ICO do for Indian ophthalmologists, yes. Let's say for a younger Indian ophthalmologist. And one thing is
There's a better mic here.
One thing is, yes, much better. One thing is, of course, the exams, standardization and demonstration of your knowledge is worthwhile because the founders of this examination believed if you do not have to pass an examination, you will not learn anything. And I think, being quite old now, it's true. And I see it in my daughter, who is an ophthalmology resident too. They, in Cologne, in Germany, and they force their residents to pass the ICO examinations. They don't force, but they push, let's say. I will introduce this in my department too. Until now, I thought in Europe we have very old. We have 200 years of ophthalmology too, modern ophthalmology, and we think we have an education system which is old and we don't need this ICO stuff. But it's not true. I mean, the ICO exams are worldwide standard in my opinion, and if you pass them, you show what you know. Maybe I should talk about some other things and you interrupt me then.
No, go ahead.
The chance when you pass the exams is that you can get a fellowship. And we have our fellowship coordinator, Cordula Gabel-Obermeier here. I had a very beautiful picture of you in my other talk with an Indian scarf dress. Tournament. Yes, fellowships. It's especially open for, we have many different fellowships, and the newest fellowship just announced in this other lecture is a one-year fellowship at the National Eye Institute in Ophthalmic Genetics. And as you hear it first, you could be the one who apply for this fellowship. Of course, it's a very special one because it's at the National Eye Institute. It's 1 year. But the regular fellowships are 3 months fellowships. And what I could say about India here is that we had in the last 10 years about 230 fellows from India going to one of our 135 hospitals abroad and experiencing foreign ophthalmology. And I can say from the fellows I had, let's say 10 years ago, I see one sitting here even. 10 years ago, the fellows came and said, well, you very interesting instruments and so on. Now they come and say, oh, you are working with this stuff. We have even better sometimes. But they still learn something in a foreign country. So it's still good to go to another place. And even if you know better, and sometimes I have the impression if they have passed the advanced exam, you know, they know better than many of our residents, they still can learn something and they can see differences and can learn from the differences. But the other thing for India is, of course, that they are not only sending fellows abroad, but they are taking fellows, and India has taken 130, I guess, fellows from other countries. So in a way, India has made the transition from only sending out to foreign countries to now taking a lot of foreign fellows, ICO fellows, outside the fellows who come themselves and pay for their stay themselves. But these are people, I think, the first email this year I get a lot of emails since I am a president of the ICO because it's worldwide, and when I'm sleeping, other people are awake and sending emails. So the first email this year was from a fellow from Nigeria who had passed a 3-month stay in India and was very pleased about his stay and learned a lot and can use it now in Africa. Yeah? So this, I think I should conclude with this sentence, or with the invitation to come to the WOC in Africa next year, because it's a historic event. It's the first time that this World Congress is in Africa. Secondly, it's the year of Vision 2020, and Vision 2020 is the right to sight, and this is what we are all about to do, and especially the Indian society, of course, is helping us a lot to move forward so that we have no avoidable vision loss anywhere in the world. I think that what India could do there is to show the world that you make modern medicine affordable to everybody. And this is something that what I think is very special about India. And of course, I know that you would want a WOC in India, and for that you have to see other WOCs, and then it will come to India. Thank you very much.
I think what we were going to do at this point is to have to hear from Cordula and about the fellowship, but we are lucky enough to have one of our fellows. He is a fellow from Yemen who is training in Nagpur in cataract surgery, and he was telling us how few ophthalmologists there are in Yemen. So for him to have been given an ICO fellowship to come and train here, and of course when it's safe to go back to Yemen, he'll go back to Yemen. I'd like to come up and shake your hand, Fadi Mukret from Yemen. Want to take a picture with you? You just take a picture.
There are other fellows here. I have one fellow of mine,
Oh,
which who is I met here. You know,
Oh, right.
He met me.
Do you want to come up as well? See, one of the reasons why we find ourselves so privileged that the clinicians are heavily involved in our activities is because we are led by clinicians who are actually in touch with what the needs of the people are, and as Peter showed, the needs of ophthalmologists worldwide. I just thought if you stay for a minute to see if anybody has any questions before you step on the stage.
Tell us your impressions of the organizational aspect of the AIOS.
Here? Well, this is not my first time in India, but it's my first time at the AIOS. I am an honorary fellow now, and so this is one of my societies. I feel I'm very impressed. I'm very impressed of the program. I mean, I have it here. No, I don't have it. No, they took it from me. But, you know, there's one side, this thing here, I'm very impressed. I mean, all these sessions, this is my program, yeah. Because I have it only for this day.
It is from your seat, actually.
Okay. And I see what you combine new research and clinical developments, and how you can use it for everyday practice, and this impresses me. For the opening session, I think for me it was a little bit long, I tell you honestly.
They also feel the same. Actually, when I was going around, I was walking with Peter yesterday, and every time he came across either the board, he couldn't help saying, we must have this involved, we must have this involved. A lot of things that he saw, particularly the board that you have, which summarizes all the programs as you come out at the end. That's where we had our pictures taken. But every time Peter saw one of these things, he said, oh, we must have this involved.
I think what impressed me most is that the enormous wish to show that you make it better every year, and that you make so much progress in organization and knowledge. And for example, if I hear that now the topic is every fellow one paper a year, I mean, my goodness, who should this will move you forward, yeah. I enjoy, and it's of course, you always well, you have the real high tech here, and you have things which are not so high tech, and this is what impresses me too, yeah, how you combine this and pull everything forward. I mean, to really get no avoidable vision loss, I think you need the engagement of all ophthalmologists, and this needs a lot of commitment of the leadership of the AIOS.
Thank you, Peter. I think the two of the presidents, past presidents of AIOS are here to take part in our program. Thank you very much. I think that's been a very good start. What we will now have is we'll have the fellowship program being discussed by Cordula. After that, we'll have Rajbardhan Azad telling us how we are taking forward with the new exam that Claire was talking about, that is subspecialty. Good.
Okay. Thank you very much, Arvind, for introducing me. So my name is Cordula. I'm executive in charge of the ICO Fellowship Program. I'm running the program from my office in Munich in Germany, and I do it since 10 years now. So, okay. Okay, the ICO Fellowship Program was initiated in 2001 by Professor Beider-Glor from Zurich in Switzerland, and it was initiated to help young, promising ophthalmologists from low-resource countries improve their practical skills and broaden their perspectives in ophthalmology. So this is very important for you, because this is where you can gather all email addresses, contacts, all information about the program and how to set up an application file. So it should be useful for you. So why should you apply for the fellowship program? Actually, these numbers have been taken from an ongoing evaluation that we are doing on the impacts of our program for the individual ophthalmologists. And I'm very happy to say that it proved to be a very sustainable program, that you can see more than 90% of our fellows actually say they have learned new techniques in diagnosis, in treatment and surgery through their ICO fellowship, and I think you can both agree to that. Also very nice is that 95% of our fellows actually would recommend their colleagues to apply with us too. Oh. So the fellowship program offers applications with different durations at internationally recognized training centers. Mostly these are universities or teaching hospitals like LV Prasad or or others. So our fellows are expected to bring their newly acquired skills back to their home country and to help their colleagues benefit from the newly acquired skills as well. This is very important to us. Of course, we expect you as a fellows to contribute in national programs to prevent blindness and restore vision. Oh, sorry, that was too fast. Okay, I would like to introduce you to another pretty new opportunity, which is a research fellowship. This is for those candidates who actually are doing a research work and would like to continue the research work in an international institute abroad. This goes with a grant of $50,000 US, which can be spent by the fellow as needed for his own expenses. And it will be for a minimum stay of 12 months. I think this is a very interesting and very high reputed fellowship program. So last year we have had the first awardee, and he actually this is him, Dr. Emilio Torres from Brazil, and he was doing a research work on corneal tissues. And to his right you can see Professor Berthold Seitz. He is the head of the ICO Fellowship Program, and we work together. So some numbers about the fellowship program which are interesting to you. We have had around 1,200 fellows in 18 years so far. These fellows have come from 88 home countries, and we have 30 host countries in which we collaborate with about between 120, 130 host centers. This changes from time to time a little bit. The majority of host centers actually are in Europe, and we also have host centers in US and a significant number of host centers in India. That is very nice, and we really would like to collaborate more with you. So we offer subspecialty training in the usual subspecialties. As you can see here, the most favorite one is vitretina, followed by pediatric ophthalmology, by cornea, and by glaucoma. We also try to make sure to have more slots for retinoblastoma fellowships, because we think that this disease is too neglected and we have to help avoiding retinoblastoma cases if possible. So funding comes from the ICO itself through membership fees. We have collaborations with the national societies. We have collaborations also with the supranational societies, for example, with the World Glaucoma Association or the International Uveitis Study Group. We have a German foundation that collects funds exclusively for the fellowship program, which is the International Ophthalmology Fellowship Foundation. We collaborate with NGOs like the Fred Hollows Foundation or the Rotary Club. We have industry sponsors, and we also have several private sponsors who help us raising funds. So we are happy to say that the program is growing. The number of awards and the number of applications is rising, and this is very encouraging, and also we would really be very happy to receive your applications in due time. So I would like to stress the importance of our linkage to the ICO exams. So these numbers have been taken from our application forms, and you can see for example, 63 of our successful ICO fellows who were awarded a fellowship have taken the ICO basic examination before they started their application. And still in 2011, it were only 35% of the successful fellows who had taken the basic examination. So I can only recommend you to take the ICO exams because this really pushes you up in our scoring system in the assessment for the fellowships. So, very important again, this is where you can gather all the information and all my contact data for the fellowship program. And before you start an application file, we really suggest you to carefully read through the entire website. We have a 5-step application process, which goes from selecting the fellowships, eligibility check, review, to application to the host center, and to the submission of the application to us, which then will be followed by our review and funding decision. So if you go and wish to apply for an ICO fellowship, you should create an ICO account, and you should confirm this link by, you should confirm this, sorry. Okay, it is sometimes a little tricky to find, but on the first slide, on the bottom, you will find a link to where the application actually starts. So you will have to choose your home country, and then you will choose, thank you. Oh yeah, you can choose your home country, and then you can choose your the fellowship by duration. You will fill in your details. I would like to draw your attention to to the importance of the language. It is very important that you speak the language of the host country. It must be, and usually it is English, but if you go to another country where English is not spoken, then we really recommend you to acquire some basic knowledge, because this will help you dealing with patients, and this will help you dealing on your daily basis in the street. So candidates are eligible once they come from a low-resource country. They should be ready specialists in ophthalmology. They have completed their residency training, and they should bring 2 recommendation letters from their present and their previous chair. We expect fellows to be highly motivated, to bring back the skills and knowledge that they have learned to their home institutes. And I would like to again mention that we consider the ICO exams in our assessment, and we also consider the membership of your national society. So if you are a member of the AIOS, then you are a member of the ICO because of this membership of your national society. We ask you to answer 3 questions about your motivation, your expectations, and the impacts that you wish to gain from the fellowship. Please be aware that this is a very crucial part of your application file, because this is where we learn from you. You must consider that we are not offering a curriculum, because we want you to discuss your individual questions with your host before you apply for the fellowship, and so that you can find individual answers to your individual questions. And please be very detailed in answering to these 3 questions. This is the candidate's declaration. You will have to confirm that everything that you have stated in your application file is correct. Once all this is complete, you will submit your application for the eligibility check. If you're eligible, I will let you know by an automatic email. If you're not yet eligible, then I'll write you a small email and ask you to submit the missing documentation or fill in the gaps. Once a candidate has been determined eligible, he can move on to our fellowship host directory, and the directory can be filtered by subspecialty, by country, by city, or by duration, or even by name of the host. So it is always worth looking there. If you click on the host's name, then you come to the details of the fellowship center, which is interesting for you. You will find some characteristics and some basic information on the fellowship center. Please pay attention to this part. Most of the fellowships actually are classified as observerships, because this is due to the national regulations in the host country. And please pay attention to that and keep in mind when you apply to US or to Europe or Australia that it is not us who allow you to have hands-on contacts or surgical exposure, because we have to stick to the rules of the host country, of course. Okay. Choosing a host actually triggers an email with your application summary and sends it automatically to your favorite host. The favorite host may confirm or decline your request. And if he confirms, then you're lucky. Then you can agree on a start date, and you can complete the host acceptance form. And please, once it is complete, send it to me so that I can process your application file. This is how the host notice of acceptance looks like. Please know that I can only process applications which actually include this completed and duly signed host application, host notice of acceptance. This is very important. So keep in mind that our hosts are supporting the program because they like to have the contact with guest doctors from abroad. As Professor Wiedemann pointed out, they do not have any earnings from the program, and they support the program because they are convinced that it is a sustainable program which will help increasing eye care delivery worldwide. Once your application file is complete, you should keep in mind that we have the application deadline. So we have 2 deadlines for the 3-month fellowship, and we have 1 deadline a year for the 1-year opportunities. What is important when you do the application file, it is important to read the instructions carefully. Please check the FAQs for answers if you have any questions. If you don't find an answer, please contact me. I'm happy to help. It is very important that you consider a little bit your application performance. It is important to try not to trap into these cultural gaps. And please start your application well in time. So maybe 4 to 5 months is recommendable. The criteria for the assessment, we have the formal criteria, like if you're a teacher, if you are doing the ICO examinations, if you come from a ICO member society. We consider the application performance. We consider a lot if someone's on a teaching position or a public services position, and we are very much looking for candidates who are highly motivated and whose training would make a highly relevance for the home country. So we also have a fellowship group on Facebook, and we invite all fellows to take part in that. We do these regular symposium together with the ICO examinations team, with Dr. Davey, and with the ICO education team. So we also are present at the supranational meetings at the booth to answer to individual questions. And if you've got any questions, you may come to me afterwards or come to the booth and talk to me. So 3 years ago, we have had the 15th anniversary of the ICO Fellowship Program, and we have made a small report about that. This is downloadable from our website, and if you want to have a look into it, please feel free. You will find a lot of information on the program there too. Okay, this is the link to it. And again, this is our URL where you find all the information about the program, and also my email address. And please do not hesitate to write to me if you've got any questions. I'm really happy to help. Thank you very much for your attention. And also, I would like to see you all in Cape Town in 2020. Please come and join us there and help us enhancing eye care worldwide. Thank you so much.
Thank you, Cordula. Cordula will be here at the end of the session as well as at the booth to answer any questions. We have been fortunate enough to listen to senior teachers in our world of ophthalmology. We heard from Peter Wiedemann, and we've got Rajvardhan Azad and Dr. Ashok Grover. What we did in the last few years, in addition to the exam that we held, there was a decision to hold exams in subspecialties. The idea came from senior Indian ophthalmologists. Dr. Grover is on our team of international team of examiners and those that meet in May every year to add to it. And once the decision to hold subspecialty exam was taken, Dr. Rajvardhan Azad, as the chair of the collegium, volunteered to lead the show as far as the AIOS was concerned. So we've had meetings. 2 years ago, we ran the first trial or the pilot of subspecialty exam, and it was so well received that after that we have increased the number of specialties, subspecialties, and from next year we'll also include cataract. So to give us a brief overview of how he intends to take the subspecialty program forward, not just in India, but in surrounding countries where he has quite a significant footprint, both in terms of his knowledge and his fame, Dr. Rajvardhan Azad, the current chairman of the collegium.
Thank you, Arvind, but you wanted me to speak on the importance of fellowship program. So, Dr. Azad karke hoga. So I prepared that, but nevertheless, I'm not going to talk about the logistics of the subspecialty exam in India, but why it is important to all of you who are sitting here. आजाद करके है? अरे अभी तो दिया यार, इसमें तो है. उधर वहां दिया हुआ है मेन में. है क्या बात करते हैं आप. Anyway, so what is the need of subspecialty? The need of subspecialty, the basic idea is we want to prevent blindness. We have been, so far we have been, focusing on cataract. And with the passage of years, with the advancement in the technology, the priorities have to be changed. And that's why the requirement for such specialists are there. You just heard about the ICO basic exam. You heard about the advanced exam. After that, there is another level, I am a retina specialist. I don't have any, specialty degree with me. But now with this exam, what we call as a FICO is a Fellowship of All India Ophthalmology Collegium. So FICO is the, the subspecialty certification diploma, which we give to our candidates, those who have cleared post-graduation and they want to get into either cornea, retina, ophthalmoplasty, and so on and so forth. So this is important from the point of view of providing quality care in any country or any nation or any continent. What is the need? The need is, I am there in SAARC countries. I know which country has got what kind of subspecialist available with them. We need to have all kind of subspecialists in definitely all the specialties. But not all the countries in the SAARC region they have, unlike India. So for that, you have to understand what is the demography, what is the need. Earlier, say about, before, say, 1980, the focus was on cataract. So most of the countries in the SAARC region, they were focusing on cataract. But later, when they focused on cataract, after that, the requirement changed, the demand changed. And therefore, this is very important to understand what is the demography of blindness. And also, you identify the disease, which disease is important. Like, you know, nowadays, lifestyle disease is very important. As we were talking yesterday, diabetes is now becoming one of the most important disease. You know, Natarajan, you know, he has launched a massive campaign in India for screening of diabetic retinopathy because it is important. And it's very important not only from diagnosis and point of view, but also from preventing the blindness, diabetic blindness for that matter. And therefore, it is very important to prioritize what is the disease which is present in your country or in your situation. Why there is a need for subspecialist training? The need is because many places, countries, big countries like India or even the surrounding countries, there are certain, paucity of infrastructure for training. There are not many centers where training for all the subspecialties available. And therefore, this fellowship program is there. And therefore, ICO, just now you heard Cordula. And the Cordula made a presentation where she told you about the facilities which are available for subspecialist training. So the lack of infrastructure training is a very important, reason that we should emphasize on subspecialist training. The training opportunities are not there. I'll show you, I'll just, in the next few PowerPoints, you will find that what are the places where which subspecialty is lacking and where there is a need for the training. And then on the top of it, why I started a fellowship certification program in India. The reason was that people were having, this training in different centers in India, and they had a varied standard of knowledge. Some was good, some was excellent, and in between was very good. But then, that was affecting the blindness in India. The basic aim of, the training was that you are a specialist in, say, vitreoretina. So you will handle all the cases to best of your knowledge. But if your knowledge is inadequate, then you can't do it. And that was the reason why we started a certification, so that you will be certified at one particular level. This is the benchmark. And you have reached the benchmark, and then we believe and we expect. And that is what the diploma says. That this diploma tells the people that this guy is trained in this particular subspecialty and he is competent enough to handle all kind of cases. So that was the basic idea of starting this certification of fellowship program. So we need to have this structured, this structured surgical teaching program or the subspecialty program. In few centers in India, now many centers in India, we have this structured fellowship program, and the people who are coming out of it, they're excellent. Teachers like us or anybody for that matter, even for the patient. If somebody has come from A institute and he had a subspecialty training, and the guy goes to for his practice, and the patient sees he's a wonderful doctor, he's a wonderful surgeon, because he had a structured, fellowship training or structured surgical training. So that is very important. Now, as I told you earlier, in India scenario, in 1977, the National Program Control of Blindness was started. I was one of the witnesses to that. And those days, there was a focus on cataract. Now, the cataract backlog is very minimal. Way back in 1990, the cataract backlog was almost 25 million cataract backlog. And today, if you ask me, there is only 5-6 million. So that way, because this program came. And when this program came, after the cataract has been taken care of, now the other diseases are appearing, like the retina is there, like ophthalmoplasty is there, like ocular trauma is there. All these things are now appearing, and the government is focusing on that. And that is the importance of subspecialty training. What is the scenario in SAARC country? As Arvind was saying, that I have a footprint in SAARC country. But footprint means I know the pulse of these countries, where what kind of fellowship is there and what kind of subspecialties they have. Like places like cataract, glaucoma, Nepal. Nepal has good, but only few centers are there where this facility is there. Like Bangladesh, something I have mentioned here, cataract, glaucoma, retina, and all. Pakistan and Sri Lanka. So not all the countries in the SAARC region, they have a very good structured fellowship programs are there, training programs are there, where we need to develop this, and where I want the help from the ICO. We will form a nodal center here, and the ICO will help us, and we will try to give them the feedback, and we will give them the whatever the infrastructure we have, so that we can, form a kind of a group to support the people who are coming as a subspecialist in this region. Now, why we are a little bit lagging behind in subspecialty training? I will not name the country, but there are many countries in the West and few countries in the East, few. Because I know everything, because I have been to all the places. I have the understanding of the kind of training, resident training, fellowship training. I have the understanding. So why we lag behind? Because most of these countries in this region, they were focusing on the national survey output. And all the national survey output in these countries, gave the information that a cataract is the main cause of blindness. And so cataract. But now, more so from year 1990, there has been a fast-track development in the training of subspecialists in India. And Natarajan is sitting here. We are all, both of us, trying to push very hard, and hopefully we'll be able to do it very nicely with the ICO. And as I told you, this is the lifestyle diseases which are coming up. We have to change our focus from cataract to these subspecialty. That is very important. And then on the top of it, I always say there is an advancement in technology. But the advancement in technology in medicine has been rapidly there in one specialty, and that is ophthalmology. Ophthalmology has seen tremendous development in the technology. And to keep pace with this, we need to have subspecialist training, a structured subspecialist training. So we have to prepare the workforce in subspecialty. People who are sitting here, I don't know how many of you already had training in this subspecialty, but then you need to be trained, and our job is to provide you the training centers. Our job is to provide you a credible degree. The advantage of, although Cordula has spoken, and before Claire has also spoken, the advantage of associating with ICO is what? They have already spoken. I'll tell something different. Different is that ICO, the standard of ophthalmology in India is, as yesterday you must have heard Natarajan's, the lecture, the presidential lecture. So many things are happening in India, from artificial intelligence to robotic development, and from there to primary eye care in the rural areas. So see the wide range of development of ophthalmology in India. That is there, but then to have an impact on the international arena, we have to associate with International Council of Ophthalmology. And that gives you a credibility, a benchmark, and a standard. So for that matter, you all are, you should take notice of this. And if those who are not trained in subspecialty, you should opt for it. We are having a joint exam from this year. We will sign the MOU this maybe in the evening today, and then we'll be having the exam beginning I think in September we have these exams, and then we'll join with the ICO, and then you'll not get 1 degree, but we'll get 2 degrees. So that is the advantage. So thank you very much for giving me this opportunity. If you want to ask any question, you can ask, or maybe later, because I have to go to another session, so I have to go there. Thank you so much.
Thank you, Raj. I think I see that we've been joined by Natarajan. I must admire Peter Wiedemann and Natarajan, because after the election of Donald Trump, there are very few people who will publicly accept being called presidents. I'll now invite Nati, because thanks very much, Natarajan, to give us his vision of where he wants to take ophthalmology, particularly with AIOS in the coming days. And after that, we'll hear from one of our most eminent teachers, Dr. Ashok Grover, who presumably will add to Natarajan's message, because very few people actually disagree with Natarajan. So, Nati, would you please?
First one. Anyway, at that outset, I thank Dr. Arvind Singh for coordinating with us, with the All India Ophthalmic Society, and plus Dr. Rajvardhan Azad and Dr. Ashok Grover, and also thanks to the ICO President, Dr. Peter, who has come all the way as a President's guest. And I think the vision for All India I've already given. And I want the talk where they asked me to give was a benefit of taking ICO examinations, and we have a ICO mission. You have listened to all the ICO what's happening. So that I think the goal is to develop more effective teaching program. And I think, as just now Dr. Azad mentioned, and we are one of the, I think this is I don't remember, it's not at our center, but the ICO exams are conducted. The worldwide medical specialty exams, independent and free of any outside influence, can be taken in the candidate's own country, and the questions are prepared by an international group of examiners. So India has multiple centers, and the designed for those entering ophthalmology training and first-year ophthalmology residency training, and meant as a knowledge assessment and learning tool. The assessment is accessible worldwide at all times, emphasizes basic and practical ophthalmology learned in the first year of training. The ICO standard examinations are divided into 3 subjects: the visual sciences, optics and refraction and instruments, and clinical ophthalmology. The visual science examination is frequently taken early in residency. The training consists of 120 multiple choice question, 3 hours, 4 options, single best answer, 60 single best answer questions, 1.5 hours, 4 single best answer options with 1 correct answer. And this is for the clinical ophthalmology part C. And then to discover whether candidates have acquired the breadth and depth of knowledge of the clinical science. And it's the best time when you are starting your postgraduate, when you are taking your university exams or DNB exam, you should be prepared for this. And to enable them to recognize and treat disease of the eye, which they will come in contact with in a day-to-day practice. To test up-to-date knowledge and also and a high level of common sense decision making. Passing it will, along with the local face-to-face examination, will entitle the successful candidate to use the post-nominal acronym, the FICO, Fellow of the International College of Ophthalmologists. And the subspecialty examinations are to be held in the following subjects: cornea, external eye disease, glaucoma, medical and surgical retina, oculoplastics, neuro-ophthalmology, pediatrics, and strabismus and uveitis. And these examinations are offered to ophthalmologists who have had 1 year experience in their chosen subspecialty. And All India Ophthalmic Society started the FACO with Rajvardhan Azad and later by Dr. Grover. And the benefits of taking the ICO exam: these are tests of knowledge to a very high international standards in the subject. And then the candidates who pass any of the sections of the examination will have a knowledge base relating to the section, will equip them to practice ophthalmology, leading toward consultant practice. I think this will, along with the local examinations in whichever country, including India, it will help you to have one more where the patients also knows that you are being thoroughly examined again and have a certification that you are a good ophthalmologist, and develops high level of common sense and decision making, has a unique marking system that encourages precision and accuracy, which are essential characteristics of competent ophthalmologists. The areas which I already mentioned, and they are good exams to be done during your residency because they allow you to self-monitor your performance and your level of training, and that's important because there's no spoon feeding. At least you can check yourself. Passing the ISO basic and the ONR and gives the candidate the exemption from the Royal College of Physicians and Surgeons of Glasgow, Part A, and Clinical Science, the MCQ section of Part B, and it's a great advantage for the candidates because they do not have to take multiple exams. Candidates who have previously taken the ICO basic exam, optics and refraction or FRCS Edinburgh, Part A and clinical sciences are in the middle of taking the full set of these examinations will be required to pass the ICO's advanced exam to qualify for the membership with the Royal College of Surgeons of Edinburgh. The ICO is currently working with the Royal College of Surgeons of Edinburgh to increase access to the OSCE and VIVA exams, which will then allow candidates the opportunity to become a fellow of the Royal College of Surgeons of Edinburgh. And successful candidates have an increased chance of getting one of the 8 or so ICO fellowship each year, 80 fellowships. And distinctions or merit are assured of national and international recognition that they have achieved the highest standards. An opportunity of ophthalmologists in every country to take an international ophthalmology exam of a standard that is at least equal to any regional and national examination, and have high scientific quality and acceptability, follow the highest educational standards in ophthalmic care. However, the challenge is to secure acknowledgement of these exams by local ophthalmic societies worldwide, and All India Ophthalmic Society is glad to be a part of it. And passing the exam demonstrates a level of knowledge in the relevant areas of ophthalmology which is needed for a trainee to apply what they learn in the clinic. Some countries use the ICO examination as an entry to their licensing procedures, raise the standard of ophthalmology in many countries to benefit the benefit of the population as a whole. And the examination are not a test of competence or a license to practice, but its presence has encouraged several countries to have their own face-to-face exam test to competence to practice. And I think many young ophthalmologists love this, and the successful candidates use the qualification to prove a level of knowledge for advancing their career. So in summary, are internationally recognized. That's important because I think one day probably you can write all your exams in India and get a job anywhere in the world, which is not practically possible today because each country has something. But still, it gives one more additional rather than the local MS or DNB, which is important for practicing in India. Test up-to-date knowledge, increasing chance of getting ICO fellowship, and that's another important because ICO fellowship is about $5,000 for 3 months, and it's a great thing. And I just saw Peter presenting about 250 people from India have benefited, and that's a real benefit for AOS becoming a member of the ICO and give a badge of recognition. And thanks again for coming to the to celebrate 200 years of glorious years of modern ophthalmology in India. And thank you very much for the opportunity. Thank you, Arun.
Thank you, Nani. Thank you very much. As a vitreoretinal surgeon, I've had all my doubts cleared by Dr. Natarajan over the years. Thank you very much. I think what you've heard until now is how the examinations are delivered and what benefit it brings to you. Now, there is a common perception there are a group of people sitting in the UK deciding on the fate of what the examinations to do. But we have a very important international committee on which Dr. Grover has served for a long time, which sees the examinations from the examination side with the candidates' sympathies in mind. In fact, when there was a move about 2 or 3 years ago to see whether India, given its prosperity, should have a higher fees, Dr. Grover was one of those, the committee in London, who argued very strongly to keep it fair to the candidates taking the exam. As someone who's been a member of the committee in London, of the examination committee, which meets in May every year, it's my pleasure to ask Dr. Grover to share his perspective on ICO examinations.
Good afternoon. I think you've had a series of wonderful talks on ICO examinations. I don't really think you need a talk any longer. So we'll need to discuss what your concerns are, why you are here. So I'll put up the slides. So I'm glad that all the previous talks have made my talk. Where's the projection? Yeah. So the relevance in Indian context, but I can assure you that my slides, after all those talks, do not hold any relevance to this audience. So, but with my experience of having been associated with the examinations as a host for 20 years, and for having had the privilege of serving as chair of the subspecialty committee, where we pushed very hard against some very hard resistance to get the examinations going for subspecialties, and for having been a part of this committee which Arvind and I have the privilege to work together in. I think we will do best if we address your concerns. We'll have you ask your questions. I'll just run through the slides. You know what ICO stands for. You know that these are the worldwide subspecialty examinations, and that over 50,000 exams have been held. Most important issue is India is the #1 in taking these ICO examinations. India is #1 in the number of fellowships awarded. So which shows that the fellowship is relevant to us. Everybody, almost all our residents want to take it. Both my sons, who are young ophthalmologists, have taken all these exams. One has already cleared all 3. So they all opt for it. They don't need any extra motivation from anywhere because they have learned the relevance of it. So all this, you of course know what they really stand for and what advantages they give you. Of course, these are the international fees if you want to look at them, and these were the fees for Indians with group discounts, which is what most of you have been availing. And these should come down further by 10% from what I hear from team Arvind and team. So that's really nice. And you all know what everything of this has already been spoken. So I think we will best have you ask questions. So let me start by, do you have any questions, or should I ask you some questions about why you are here and what you wanted to know today? Yes, can you tell me why you came to this program and what was it that you were looking for? Did you get that, or is there something else that you would like to know? Okay. Good cricketers. Good cricketers, yeah. Yeah.
Sir, I am in now second year residency, so I have already applied for basic science and instruments.
Why did you apply? What advantage did you think it will give you?
One is that it is actually benchmark, and I can know my, as a part of residency, know my progress and my situation. It is also international acceptance standard exam, so that.
So what did you want to know about the exam that you came to this session?
Sir, my question is that for visual science and for optics refraction, which book should we follow to pass the exam?
This is a tough one. I think those recommendations are all available. Any senior who has appeared before you will pass on those lovely books which have been designed by many, many people, especially for ICO examinations and for FRCS Part 1 examination. And those books are easily inherited down the line, and everybody has them, so you will find it very soon.
I was with Rajvardhan Azad's son yesterday in the car, and he was saying the same thing, that a lot of the exams taken in India require knowledge. It's a lot of factual knowledge, but most of the questions in ICO exam are application of knowledge.
Yes.
And he found the difference. He found it a little more useful because he had the knowledge having prepared for Indian exams. And then when it came to sitting the ICO exam, he found that most of the questions concerned the application of that knowledge.
So you should look at the previous questions, banks. I mean, there are no official question banks, but whatever is available in books, so that, and go through them besides your theoretical knowledge, so that you have an idea of what kind of questions are commonly asked, how they are structured. There is a lot of effort that goes into making those questions. There was a full program on how the questions should be set, including hands-on work for all your exam question setters. And when the recommendations for these are made, these are analyzed by education specialists, by the statisticians specialists, by examination specialists, who look at each question, analyze each question for the kind of response that has been obtained in the previous exam, and accordingly classify those questions and select some of them, drop some of them based on the performance of the question. The question performance is analyzed very critically, and the results also are based on the performance of the candidates, and they're very carefully formed on the basis of the ICO curricula that are available. So look at the ICO curricula, look at the kind of questions there are, then you will be in the right preparation for appearing in these exams. Yes, please.
Yes, I am also appearing for the basic science and clinical optics and refraction. And the seniors told that for Ilkington is fine for optics refraction and Fair is for basic science.
So you could have asked her.
Is that sufficient, or we should
No,
follow
you need
some online resources? Because online, if there is any online resources or online examination we could give for practice session, that would be more helpful.
Yeah.
Is there any online resources?
So once, yeah, Arvind Velas.
That's what Claire was saying. We, for some reason, the thing has come to be known as foundation exam. It's actually called foundation assessment.
Yeah.
On the app, on the ICO app, there is a full foundation assessment, which if you want to take without any connection, you have to pay for. But if you pay the fees for any of the examination, you get that for free. And you get that for free on 2 attempts, and the feedback is very detailed. So if you take the foundation assessment, you take it yourself at home online, and when you get the result back, there is an explanation as to what you did and how you did and what you could do to change the answer if it was wrong. And another thing that Dr. Grover was alluding to earlier, every question in the examination, once the exam has been taken, our statisticians analyze as to how the question was answered by good people, by sort of not so good people. I didn't want to use the term thick candidates because most of the thick candidates are from UK. But because if it's a bad question, then the good candidates would get it wrong, and the people who find it difficult would get it. And we remove that question. If there is a question which the good candidates have got right, but people who are not so good haven't got right, we know it's a difficult question, and we want to make sure that the exam doesn't have all difficult questions. Similarly, if there's a question that everybody has got right, we know that that question must be an easy question. So every question is analyzed by a statistician. And when Dr. Grover comes to the meeting every May, we discuss all the questions where there have been discrepancies. In other words, either it was too difficult or either it was too easy. And then a combined decision by the committee is taken. Now, at questions like this, for an exam that is being administered internationally, it's very important for people like Dr. Grover to bring the local perspective in. I mean, he is aware of the training program. He has set up many training programs. So when it comes to an ICO paper, he's in a better position to say whether this question is relevant or not. If there was a question centered around something rare that takes place in South America or Africa, then Dr. Grover and people like him will say, you know what, this condition doesn't exist in India, so I think the question is not fair. So the knowledge that you acquire from any source is less important than how you apply it to your life.
And if ICO examination question paper is same for all the countries, or
yes, across the world.
Exam paper is delivered on the same day everywhere in the world, and it's translated into Spanish, into Chinese, into a couple of other languages. But the rules are that every candidate who requests a translated version gets a copy of the English paper also, because very often if there is a discrepancy in translation, then it's addressed by the fact that everybody gets the English paper. So it's the same exam administered the world over on the same day. in a moving time zone. The girls spend their time in the office all night because it starts in Australia first and then comes across, and until it's been administered to the West, it's all the same, because we don't want people to be phoning in from Australia answers to questions that you have. But our statisticians make sure that the questions are randomized and the answer sheet matches it. So even if you're sitting next to somebody and copy all his questions, the chances are that a lot of those questions have been changed in order. Only in order, but not in content. The content is the same.
Thank you, sir.
A lot of thought goes into having the right mix of knowledge questions, analytical questions, simple questions, tougher questions, subspecialty questions, basic questions, advanced questions, basic sciences related questions. So it's a very appropriate mix across the curriculum, and that it covers all aspects of the curriculum very well. So that is the great part of this examination.
Okay.
Yes,
Good
please.
morning, sir. Just now we were told that I being a AIOC member, I can become an ICO member also.
You automatically become a member of ICOs. No, you don't need to follow.
ICO is an organization of national societies. So because AIOS is a member of ICO, you are automatically a member of ICO. ICO doesn't have individual members, but it has societies as members. And All India Ophthalmic Society has been one of the long-standing members of ICO, and among the majority that actually pays their subscription. Last time we were having an argument with Ukraine and other societies that have not paid their subscription for years, but AIOS is one of the active members of ICO.
The day you become a ratified member of All India Ophthalmic Society, you are a member of the International Council of Ophthalmology as well. And each society pays a small token amount of membership per member every year to the ICO as a token of your membership to the ICO. So that.
And you get a discount if you apply as a member of a national society. Your exam fees are lower than if you just apply under your own name. So it's
the marks we score in the basic exam and further forward, are those important in getting a fellowship of our choice?
No.
Those are not.
Pass and fail is what you get, except for the merit. If you get a merit, of course, that's always an advantage.
Points are related to how many exams you've taken and passed, but whether you get a distinction or not, it doesn't matter. But if you get a merit, you get a few extra points. If you get a merit in ICO exam, but that is a small advantage over having taken the exam itself. So that's what the
Sir, so we
Sorry?
can get a
for the fellowships. She's asking for fellowship.
Yeah, for if it is for the ICO fellowships, we consider this distinction and merit.
Yeah.
Those, we give some extra points for that to verify that. Because this is really, it's not easy to get a distinction or merit and so we would like to contribute to that.
So you get points for taking the exam, and plus you get a few extra points for excelling in the exam. But I think anybody without taking ICO exam, applying for a fellowship would have a very small chance, because ICO naturally favors people who have taken ICO exams.
Yeah, it adds a lot of weightage. But there are, of course, 30% people who are from countries where the exam is not being taken so often, and they are also taken in. There are other considerations of training people in some countries where facilities are not so good. So other thoughts also come in. But yes, where exams are being commonly taken, if you've taken them, it's a real big advantage.
Sir, and I want to pursue a fellowship in refractive surgery at cornea. So which college do you suggest? Should I do the
We'll meet for that after this session.
Thank you, sir.
We have an ICO booth. If you come by the booth, you can have as long a discussion either with fellowship with Cordula or for exam, because the Claire is the chair of examinations.
Just Hall B, Hall B, come and visit, or just stay behind and we'll talk to you.
Yeah, just I think we have to make way for the next session. So thank you very much to all the people who attended it and all the contributors.
Thank you,
very
Arvind.
much indeed.
And thank you, Claire. Thank you, Cordula. Thank you, all of you. And a request for all of you to join us for the World Congress of Ocular Trauma in December in New Delhi.